Hey, Dr. Josh Wagner here. I am excited to speak with Dr. Meggie Smith outside of Chicago, Illinois. I've known Meggie for probably a few years now, but most recently, just a few months ago, she came to her first patient mastery training. And what's interesting is that from the training, she started actually applying one of the most significant things I recommend to chiropractors to make practice go a lot easier. And just like many doctors in practice, especially chiropractors in our profession, we get tunnel vision of this is how it is, this is how it always has to be. And I'm sure Meggie can relate and share the difference this one concept has made for her in her practice. So Meggie, take it from there.
Yeah, hi. So the patient mastery training was great. The main thing I came away with it was just not thinking in terms of number of visits for a care plan. I had years ago been a part of a high volume practice that was doing 36 visit care plans, and I didn't want to do that anymore. And so I then just sort of stopped doing big care plans at all. I was not recommending more than like 12 visits to people. And I wasn't giving them the best care I could. I was not giving them as much care as they needed because I was so worried about recommending too much care. And so what I really loved about switching to the time-based care model is now I just say, look, we're going to help you for 3 months, right? I'm going to do what I have to do to get you better. And it feels like this really nice way that we both committed to getting them the results they want rather than thinking in terms of like making them come in again, or what are they going to say if I tell them to come back again this week? Are they going to think I'm doing it because I want their money? Am I going to think I'm doing it because I want their money? It's been really nice to just be able to say like, I got you, right? For the next 3 months, we're going to help. We're going to do whatever it takes. And it's allowed me to actually see people more often than I was before, because it feels honest. Like it feels like I can really just tell them what they need, without worrying about that constant, am I doing this for my PBs? Kind of question looming in the back of my head. So that's what's been really nice about it for me.
That's amazing. Thanks for saying that. And you touched on something really important. You said you were, or with a practice, recommending 36 visits, and that seemed a lot for you. So you figured it seemed a lot for the patients. You didn't want to continue doing that. It didn't feel right. So you went down to 12, but I think inherently that felt like probably not enough care depending on the case. And so you were in this bind that so many chiropractors are in of like, this seems overwhelming or too aggressive. And so I'll just scrap it and go to the other end of the spectrum, whether some docs go visit to visit mentality, some docs just do a lesser number, but that didn't feel right either. And am I correct there?
Yeah. I definitely, yes. I was too worried about over recommending.
And what was your perception that patients, how would they interpret or respond to you or perceive it with the 36 visits or something of that length? What's your cat's name?
My cat's name is Marin. He would very much like to be in the video.
Yeah, he can come in.
So, what I found interesting is that patients are actually fine coming in 3 times a week at first. I had a really big barrier on that because that felt like I was recommending too much care. But I think that for me, for my practice, some people need to be coming in 3 times a week. And I feel like I can be much more honest about that. And patients are good with it. I think once we're talking about smaller chunks, right? For the next couple of weeks, you need to be coming in 3 times a week.
Right. And then how about if patients were to hear, let's say 36 visits or something in that range or higher, because a lot of chiropractors recommend easily double that many visits in an initial care plan, which by the way, I'm not putting down how many times you see a person, but it's how you communicate it that makes a world of difference. So what do you think patients feel if you were to say, or when you would say 36 visits, like what was coming off to them?
I think they probably thought it was a lot. That's a big number. My experience of selling those bigger plans was that it felt more like sales, rather than recommendations. And so.
Got it. So just because of the numbers, so I'm curious, and I don't even know if you were giving recommendations of, let's say, 36 visits was it over 3 months or over a different time?
Yeah, over 3 months.
And now you're not recommending specific set number of visits. You're just saying, hey, I'm going to work with you and we're going to get you to the best place we possibly can. And I expect it to be X, Y, and Z over 3 months. Did you lower your fees? Are they the same fees? Did you raise them? I'm curious.
I am in the process of raising the fees because when I started thinking about like, okay, what would 3 months of care and my current fees look like, generally, that number looked way too low to me. Right?
Cool.
That on an individual basis, the numbers seemed okay. But when I thought about, I'm going to help them for 3 months, we're going to make some major changes and really impact them. I thought, well, wait, that's certainly worth more than these numbers I come up with.
So. Perfect. So huge point right there. You're not charging necessarily based on what you do in a visit or how many visits you see them. You're charging based on a relationship and the difference it's going to make in their life. And you went from recommending a certain number of time and visits that kind of felt like a sale to recommending the same amount of time at the same fee, and sounds like you're going to increase it, and it doesn't feel like a sale. That's a big, nice change.
Yeah, what's really nice about it is that I can say to patients very honestly, you can do per visit. I genuinely think this is better. I think I'm going to be able to help you better, and it feels like a really honest.
Perfect. And it's not like my way or the highway, like could be taught to a lot of chiropractors. Like if you don't want it this way, then I'll find another chiropractor for you.
Right. No, It's look, you can do it per visit. That is absolutely an option. I really genuinely, honestly believe doing the 3-month care plan is going to be better, right? We're going to have a relationship. We're going to be able to work together. And I really like just knowing that I can then have them come in when they need to, right? And not worry about, we get charge extra.
What they need is genuinely what's in their case's clinical best, interest, not what you set up as a proposed care plan before you even put your hands on them or adjusted them more than a few times, which also is just a lot more clinical congruency.
Exactly. Yeah.
There's one other piece you wanted to share, the difference it's made in getting patients to understand that care takes time. It's a process, or healing takes time. What's that's made a big difference for you?
So what's made a big difference for me, and really it's in terms of, once again, me realizing that patients understand this is a process, right? And so one of the things that I've also incorporated a lot is asking patients, how long do you think it's going to take for you to see results, both short-term results and also resolution of this problem? And what I'm surprised by time after time is that patients get it, right? I mean, right then and there, they say, I think it might take 9 months. I think it might take a year. And so then I can really approach this relationship as like, okay, I'm not overselling them.
Right. And that was like one question that probably took 9 seconds at most to ask. You didn't have to walk them over to a chart with like lines going up and down and explain it, or make them watch a video or give a 40-minute recommendations. Like, it was one question.
It was one question, and then I could recommend what I thought was best without having in the back of my head thinking like, oh no, they're going to think this is too much care. Are they going to think I'm overselling them?
Right.
I know that they already know that healing takes time.
Right. And most of them usually overshoot what your recommendations are in terms of time. Right?
Absolutely. Yeah.
And probably that's 90 to 95% of them. The ones who don't, then you already have a clue like, okay, I've got to explain this in a different way because we're not on the same page. And you're going to do that before surprising them with, this is what you recommend. So it's either way, it works, but 95% of the time it just works beautifully.
Yeah, it's been really great. It's been nice to really just, again, feel like I'm better able to have a relationship with my patients.
Awesome.
Because we're talking about these things, which is what you got to do to have a relationship with someone.
Awesome. Anything else you want to share in terms of just a difference of how practice feels before, like going with the old school, like this is the only way, to new ways of connecting and communicating?
The really other big change that I made after the patient mastery weekend was I just stopped counting my PVs completely. It used to be I'd come home the other night, my boyfriend would say, how was your day? And I'd say, well, we saw this many people, right? And he was like, well, that doesn't really answer my question. But in my head, how many people did we see was the answer to how was my day. And now that we're doing time-based care plans, it doesn't matter, how often people come in. They come in as often as they need to. And right. So
which does not mean like it's not like a membership practice, come when you want. That's important to realize.
Correct. Yeah. Right. It's you're doing better. Come in, we'll take you down to once a week, or you're struggling a little bit. Let's get you back in again later this week.
Yeah. Like you're 100% in charge of their case as the doctor. And what's beautiful is you can have a lower patient visits in a week, in a day, in a month, and actually have more collections And again, everything felt great about the relationship.
Yeah. Yeah. So it's been nice to be able to really refocus on the patients and what's best for them rather than that number of what are my PBs.
Yeah. Where so many doctors live and die every day or every week on that number, which
Right.
doesn't even have to translate to collections or income. So,
correct. Yeah.
Meggie, thank you so much. I believe you're going to be at the upcoming Dallas training, right?
I'm going to be in Dallas. Yeah. I'm looking forward to it.
Awesome. And since that's your second, consider, because this happens with every doctor, as good as Chicago was, you got about 20% of it because it's your first time. Dallas, you're going to get 80%, and it's just going to take it to a whole nother level. So I'm excited a month later from Dallas hearing what practice looks like and feels like.